I was gonna make a whole video about this, but there's really not a lot to it. If you've ever seen videos on how people use stoma powder, or if your stoma nurse has ever shown you how to use stoma powder, you might have heard of the crusting method. And that's where you like put a little bit of the powder on and then you wipe it a little to kind of build up a barrier around your stoma. Things like I used to do all of that. I used to be very technical and very precise, but honestly now I just take it, and after I've shaved and cleaned everything really good on my peristomal skin, right before I'm about to put on, a barrier ring or my flange in my new bag, I just spray or apply. I guess, do you spray a powder? You squirt a powder? I apply the stoma powder just around the base of my stoma, and any excess powder on the rest of my skin, I just wipe it away because I don't want anything like directly between my skin and the flange. But I just get it really nice around the base of my stoma. That kind of prevents moisture from getting out onto the skin and everything. Then I put on a barrier ring, or I just put on depending on how good my skin is doing, I might just put on my flange, and then I'll heat my wafer for a bit, or flange, vice versa, whatever you want to call it. And this is one of the perks of having a two-piece, is I actually just get some gauze and hold it over my stoma and the flange without the bag on yet, and I just heat everything up for a few minutes, and then when I'm ready to put the bag on, then I just kind of like make sure it's still all clean in there with some gauze. And then one more time, I take this and spray it around the base of my stoma. I'm just trying to make sure that I can prevent moisture from getting to the flange and everything for as long as possible, so that you can keep your barrier from melting as long as possible. So it's pretty simple. I just kind of put it on there, brush it off the rest of my skin, and make sure I'm good to go.